Any other? All right, we are live on YouTube and we're on Zoom. Good morning, everyone. It is 8:03. I'm Deanna Diamore, Director of Health for the City of Norwalk. I'm gonna call the Board of Health, the June 27th, 2023 Board of Health meeting to order. Present, we have board members Terry Quell, Norman Weinberger, Ken Lalim, Joan McNeil, and Janet Karpiak. And we have health department staff. We have Dr. Reed. We have Aniela Fignon, Brian Weeks, and Megan Fogno. Good morning, everyone.
Good morning.
Morning.
The first item on the agenda is the approval of the April 25th, 2023 meeting minutes. Do I have a motion?
I move.
Dr. Weinberger, do I have a second?
I will second.
Thank you. Any discussion on the minutes? Any corrections, additions?
No.
All right, hearing no discussion, I'll call for a vote. All those in favor say aye.
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 Any opposed? Abstentions? All right, minutes passed. Thank you, everybody. All right, the second item on the agenda is the director's report. So wanted to let everyone know that Adrian, who's worked part-time for a while, he was our former relocation officer. He used to work full-time, then he worked part-time, who's also assisted with our eviction services. He's officially retired. And so we're taking a look at that job description. He had many years of service at the health department. We're really thankful for everything. He had been in the social services department many years ago. And then when social services became regionalized, he then came to the health department and did a lot with relocation, eviction. And then he also did health inspections, food. So he did a lot for the department. So we're thankful for all his years of service. But we're looking at his position and what it will look like moving forward. And so we're looking at, again, assistance for relocation and eviction for Bill and his staff, but then also thinking about lead inspection as well, because as everyone has probably heard that the blood lead levels, the action levels have been reduced. So there'll be more inspections that are required for us. And so we're thinking that also could be a good position to provide additional support for a lead poisoning prevention program. So we're currently working on that job description and hopefully we'll have that posted soon so that we can get additional person on our team. We also are working on posting a part-time position to work with Brian. It's a public health specialist position, but focus on being like an analyst to assist Brian with data and also like with GIS capabilities we're hoping for. And so that position is grant funded, but we're hoping to bring somebody on to assist Brian with his work. So we're working on that. And we'll share the postings once we have those out. We also are busy with our strategic scholars projects. You may recall that we were one of 5 projects or locations selected across the country to participate in this program. And so we've been meeting with a consultant to help, we completed the trainings that were focused on finance and contracts and contract management. And now we've been working on a project. And one of the things we've been focused on is our clinical services. And this work began, Dr. Reed assisted us with looking at insurance and looking at, different vaccine providers and looking at our travel and adult immunization clinic. And so now we're trying to figure out how do we operationalize and formalize like a study of the program and how can we utilize that to expand in all our different other clinical areas to really look at all what we're doing. Should we be continuing what we're doing? Should we be making any changes to make any improvements, both from a fiscal standpoint and a community health perspective? And so it's a really quick project. We have to be completed within a month. So right now we're trying to come up with a guide for how we want to go about what needs to be included, who needs to be engaged in these discussions. Spoiler alert, the Board of Health is one of the audiences we want to engage in the process. So we'll be outlining you all as part of that, reaching out to the city CFO and other leadership to look, at the program And so really want to thank Aniela, Brian, Megan, and Darlene, because we're the ones that are, participating in the project itself, but then we're going to be pulling other people in as well to continue it. So just wanted to give you that quick update. Also wanted to let you know that the commissioner had her semi-annual meeting last week that for local health directors. So I attended that, and I was asked to present on how Norwalk spends our per capita funding. Because when the commissioner came to visit and she talked to us, she was really interested in hearing about, how we use per capita. And, I told the story about how Tim put the project coordinator on the per capita funding, and how after several years, we were able to advocate to get that city funded. And so really gave the story about how Norwalk has really supported public health and local public health. And so I was able to share that story with other health departments across the state and talk about how really a lot of strategic thinking goes into deciding how we use that per capita funding from the state. And of course, gave shout out to Tim and all of his leadership in the past, and how we've really tried to carry that through and continue that work. And so that was a great opportunity. And then I also want to let you know, as you know, I've been serving as the president of the Connecticut Association of Directors of Health. Tomorrow, I will be officially the immediate past president, so I'll be passing the reins on to somebody else. So I'm thankful for the opportunity to serve, but I look forward to supporting the future leaders of the association. So those are my updates. Any questions? All right. Okay, I'll move on to the next item on the agenda, which is the reappointment of our medical director. So David Reed has been serving at the health department. Is it 2006 that you've been at the Norwalk Health Department? And
I was young when I started.
You're still young. And he's been supporting our clinical services, overseeing our clinics. We've been able to do all of our clinics because of Dr. Reed and his support. As you know, we have the travel and adult immunization clinic, we have the sexual health clinic, we have tuberculosis services. And he's been very involved and instrumental in the travel and adult immunization clinic in particular. He's been serving patients. He's really good with people. I think that's something you enjoy, right, David?
It is. It is. I'm an administrator otherwise, so I enjoy my patient contact these days.
Yeah. So he's been supporting that clinic. He's been, overseeing and providing guidance to our nurses and our other clinicians for sexual health and tuberculosis. And so we're at a time where we need to reappoint Dr. Reed. And so I'm coming to you all as the board. In the past, the board has been the one to officially vote and vote on reappointing Dr. Reed. And so as we re-up our license and we're continuing our clinical services, wanted to bring his reappointment up to the board. So wanted to know if there was a motion to reappoint David Reed for medical director for the health department.
I so moved. He's done an excellent job, and I think he should continue, particularly with a sense of humor.
Thank you.
Thank you, Dr. Weinberger. Do I have a second?
I'll second.
We have a second by Terry. Thank you. Any discussion on Dr. Reed and his reappointment?
Just a big thank you. We have been, I don't remember when I got on the board, but it's been a pretty long time too. So we enjoy working together, and he's done a terrific job for us. Appreciate it.
Thank you.
Thanks, Terry. All right, hearing no further discussion, I'll call for a vote. All those in favor, say aye.
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 I heard all ayes, so I don't think any abstentions or any opposed. All right, so it's unanimous. Thank you, Dr. Reed, and thank you, board, for the reappointment. Look forward to continuing working with you, Dr. Reed.
I look forward to the coming years to continue to hopefully improve and expand our programs to the degree possible, given financial constraints.
Thank you, Dr. Reed. All right, next item on the agenda is an air quality update. So I'm going to pass this on to Brian soon, but I just wanted to share some of the work that we did based on the poor air quality as a result of the wildfire smoke from Canada a few weeks ago. And so we quickly mobilized. We worked really closely with the mayor and the superintendent, the schools on, monitoring the situation. Dr. Weinberger as well. I was heavily involved in that too, thinking about, what's best for the kids, thinking about, what's the status of the air, what's the guidance and the health recommendations based on that. And so just really want to thank everyone for coming together so quickly to monitor the situation and to get messaging out there. The mayor had put out a health advisory with us, key messages. We were able to incorporate some messaging from the state as well. The mayor issued a code red. We had social media posts, and we also distributed information to our partners and our community providers. At the same time as all this was going on, Brian was working in the background thinking about, how do we create a space for this information to be just exist on our website and to be there as a place where people can go to get the latest information and data on it. So similar to the COVID Data Hub, you might remember we used to do those continuous updates on social media messages. And then when Brian came and he elevated the work, he's able to create that dashboard and data hub for us. And so he quickly put together an air quality monitor hub, and now that's on our website so that we can monitor the situation moving forward if events like this happen. Knowing climate change and health, it's something that we're very much paying attention to. So I want to pass it on to Brian to show you the great work that he's put together.
All right. Yeah. Thank you, Deanna. Thank you, everybody. So let me just jump right into it really quickly because I know we have a packed agenda. So let's see. So what you guys should be seeing now is the NORWalk Air Quality Monitoring Hub. And so it's a little bit of a long name, but it just kind of emphasizes the point. And so this is accessible to anybody in the public and especially obviously the Norwalk community at norwalkct.gov/air. We try to make the simplest URL that we could. And so again, it just kind of starts off with some visuals and some quick, quick way to orient oneself in terms of what to anticipate and expect with this page. And so that's going to be showing anything as Norwalk specific as possible, or at least regionally specific in terms of the AQI, the air quality index. Along with some general guidance and the ability to sign up for some alerts just to stay in the know, because this is obviously on a daily basis, an ever evolving process. And so with that said, jumping into the initial part, this is the AQI kind of readout. And so what you'll see on the left-hand side is the current situation in terms of Norwalk's AQI. And so right now we're actually experiencing moderate activity. And so that's just something to kind of keep an eye on in terms of, the activity right now. Typically, as you can see in the middle infographic here, this is the way to interpret this in terms of the colors. And so, typically orange or higher, creates obviously a more response in terms of, especially for orange, unhealthy for sensitive groups. And there's some more details about that later on in this webpage. And then on the right-hand side, this little infographic here is just the forecast of what to anticipate broken down by, ozone and PM 2.5. So PM 2.5 is particulate matter 2.5. It's, been implicated in many studies in terms of exacerbating, respiratory conditions and resulting in other kind of manifestations, because it makes it into the lower respiratory system. And so it can irritate the lungs quite a bit, and then obviously even cause cardiovascular and other effects too. And so it's very important to keep an eye on it. And so that's something that's been produced as a result of the Canadian wildfires as well, and making its way all the way here to even the Northeast. So with that said, this infographic you can click, you can learn more about air quality. And this will link out to the EPA's, Air Now website, which has been really the de facto resource for most of what you're seeing on the webpage. This is, again, just a way to compile and have everything on one webpage, as opposed to having and expecting the public to go to multiple web pages and piece it all together. We're piecing it all together for the public. And then so with that, there's the more detailed table or chart just to interpret these colors. So green, yellow, orange, red, purple, maroon. And you can see how it associates with the AQI, and then also subsequently what it means, and in terms of just general guidance of what individuals should do, and especially in terms of risk effects, health effects. So with that, also you want to take in the perspective of the national and the state perspective too, in terms of AQI. So as you can see here on the left-hand side, the current air quality, and you can see how Chicago's not doing so well. They're actually in the red in terms of the air quality at the moment. Then you can also see the air quality forecast and what's going to generally play out for the remainder of the day. But it seems like the Midwest definitely is going to get hit quite hard. But you can see also relative to us, we do have that little bit of moderate activity relative to some air quality. So that's just something to kind of keep an eye on. And this is just a great way to kind of see that. And then with that, we also, with permission from Hearst Media, they have a really great infographic showing AQI. But then also, if you click here, you can also see the wind current. So you can see the direction and the speed that the wind is blowing as well. So you can kind of piece it all together and see how this is all impacting us. And you can see how the wind currently is blowing somewhat to the northwest of the state. So that's just something else to kind of help anticipate how things are going to play out for the rest of the day. So just another great way to see what's going on. And then with that, also there's the Air Now app from the EPA, and so everybody's welcome to download that to their Android or to iOS. And that's also a great way to stay in the loop about things, track the smoke plumes, should there obviously be additional plumes that make their way our direction, as well as just, other up-to-date forecasts. And then again, just kind of piecing together air quality and health. Again, that can, exposure to air pollutants can obviously manifest in headaches, irritated eyes and sinuses, fatigue, difficulty breathing, chest pains, asthma attacks, irritated throat, and increased coughing. At minimum. And so it's just, something just to kind of really educate the community as well about, how everything's interconnected in that nature. And then also some general guidance, what someone can do to reduce their exposure outdoors and indoors. So again, first of all, is knowing what the situation is so you can react accordingly. Then also, you could choose to wear a mask, especially obviously somebody who's sensitive to these particulates, say if they have asthma or they have COPD or other kind of respiratory conditions that would be easily exacerbated even at low levels or quantities, they can kind of wear a mask respectively. And then typically that is recommended to be an N95. That would be much more effective than say a surgical mask. So in some ways kind of mirroring the guidance even with like when we were talking about COVID all those years. And so in that sense, also rescheduling and modifying outdoor activities to reduce exposure. And then indoors, obviously, closing the windows and exterior doors to reduce the ability for that air externally to make its way internally in the facility. And then also, keeping the space purified really is the big thing. Air purifiers that are rated to actually address this, updating HVAC units and cleaning HVAC unit filters that are appropriate to actually be effective against, air particulate, and especially, PM 2.5. So that's going to require at least MERV 13 or better. But the catch is also certain air handling systems can only tolerate certain efficiency levels. And so that's something also to explore as well, whether it's a residential or a commercial facility. And so, yeah, that's kind of just the general guidance. Again, a reminder, call 911 if somebody is experiencing any sort of difficulty breathing associated with the air quality. And then finally, just like the alerts. And so the city has a couple of alert systems. So just making the public aware of this. So number one on the left-hand side here is the Code Red system, which is all the emergency alerts. So definitely being signed up for that and creating the profile online. And so this directly links out to that. Then there's the Notify Me for the city that also kind of links out to, any committee meetings or anything else that might be going on in general news, but also it does include some emergency notifications. And then finally, I think it's a really great resource. This is the EnviroFlash from, the EPA's Air Now. And basically you could set a threshold. So if you choose orange or you feel it's more appropriate to use red or even yellow, you can set the threshold for when alerts will be made to your attention. And, again, our air quality monitors sensor for our region is in Westport. So very fortunately, very close. And so it's a good indicator still what's going on. And then so you can kind of get these notifications. And again, the general guidance that Air Now would even provide. So you'll know right away as soon as they detect that, things are shifting or getting worse. And again, that will be the current situation and forecast. And then also just additional resources that contribute to this. And then finally, the social media profiles for the city, the city health department, and then also Air Now just to stay in the know should, obviously anything change or be other contributors enter the arena in terms of affecting air quality. So that is the Air Quality Monitor Hub. Again, norwalkct.gov/air. Please spread the word, but this is a great way to centralize all this information and, be able to stay on top of things because it gets updated in real time. Thank you.
Wow, I am so impressed with that. I had not seen it. It's thorough, it's complete, it provides information on a real-time basis, it updates. I'm going to share that with a few other people I know in adjacent towns, shall we say. I think because it really serves the whole area. There's not a lot of difference between the towns here. So that is just phenomenally thorough and complete.
Yeah. Mhm.
And as
Wow.
always, a well-done project by Brian.
Yeah.
Absolutely.
Yeah. Brian, that's amazing. I'm blown away.
Oh, thank you. And again, this is an attempt to just empower the community to have all this information at their fingertips and, save them the hassle of going through all these multiple web pages. Because, sometimes there's a lot of great resources out there, but they're all on different web pages with different URLs and it's hard to dig it up and find it. So, again, I did the legwork for that just so it's all here in one place.
And he did this over a couple days, I think. Like he really, it's amazing. Thank you, Brian.
It's terrific. Really.
All right. So Brian's up next on the agenda again to give his epidemiology updates, and we're adding some informatics in there as well. So Brian, passing it on again to you.
All right. Well, how again? So thank you. All right. So I know I took some time with that, and I actually do want to cover quite a few things relative to the epi and informatics update. So really briefly, we'll be covering respiratory illnesses. Then we'll be covering Mpox. So just a little update in regards to that. We'll also be talking about mosquitoes because I think it's something really important just to keep on our radar, given the wet and warm weather that we're experiencing right now. Then I'll also be talking about a couple of CDC HANs, which are health, alert network messages, just generally for clinicians, but also for our general awareness. I think it's important because, the summertime has unofficially started, so to speak, in terms of just the different surprises that may be coming. And so just being ready for it as we kind of learn about these new things. And so with that said, I'll also be mentioning about the informatics side that's going to be kind of playing into this briefly. But yes, again, a lot to cover, so I will be moving quickly. But I will attempt to summarize as well. So with that, I'm going to start sharing my screen. So right off the bat, we're going into the COVID situation, as mentioned with the respiratory illness. Really, overall, a very good situation with the updates. And these are the new hospital admissions per 100,000 for the current week. And you can see how the Northeast is in the green, so we're less than 10, as well as the majority of the country. Only a few counties really that are experiencing this in the Midwest or the South that are having even just medium activity, not even high activity. So right now it's a very good COVID situation for the country in general. When you look at it, especially from a hospital admission rate perspective, which is one of the better indicators at this point. With that also is, just looking at, kind of what is the subvariant situation relative to COVID. And we can see it's still XBB.1.5 at the majority, but it's a slim majority now. It's at 27%. So we got quite a few other players in the field as shared in the past. But there's a lot more that keep entering. So we got XBB.1.16, XBB.1.9.2, XBB.1.9.1, XBB.2.3, XBB.1.16.1, and there's a bunch of others at less than 2% in proportion relative to the recent week forecasting model. But as you can see, respectively, for the ones I just shared, it's around 20%, 13%, 11%, 11% also as well, and then like 10% for eventually XBB.1.16.1. So basically, we have a lot of competitors in the field. They're fairly close to each other. The one thing they have the advantage over XBB.1.5 is they're slightly more infectious, and that's why we're slowly seeing this change or turn here. And so as you can kind of see here, relative to a regional perspective, it's quite a colorful pie chart relative to the regions. Again, region 2 is usually the better indicator of what's going on here in Norwalk, which includes, it's New York, New Jersey, U.S. Virgin Islands, and Puerto Rico. But as you can see, almost 3/4 of that are these new subvariants, a mixture of them. With XBB.1.5 somewhere around just 1/4 of that. So again, there is that transition that's occurring, and like I always mentioned, there is some collateral damage we should anticipate, where there's going to be some increased exposure or risk given this higher infectivity relative to these subvariants, but nothing astronomical as we're seeing because things are pretty calm right now relative to COVID, and especially because we're also experiencing some very nice and warm weather, and so again, nationally speaking, it's still 3/4 in terms of these new subvariants entering the picture. So this is something very much to keep an eye on, especially as we anticipate a new vaccine formulation down the line for this year. And then forecast right now for the models for COVID, pretty much baseline. So everything's kind of showing that we're at the baseline. Things aren't shifting or changing rapidly, at least anticipated going into July. So that's good news. Same story with Connecticut, although a little bit bumps here and there in terms of the forecasting models from the CDC. So still overall good news relative to that. And then when you look at it for the triple demic, for COVID, influenza, RSV, This is weekly emergency department visits by all ages, and you can see again, it's still showing kind of like that baseline activity, low activity. So very good news in regards to respiratory illness overall. So with that, changing gears a little bit, just looking at Mpox or monkeypox, as formerly known. This is data from the CDC, just kind of showing for the year 2023. And the thing I want to emphasize here, because the summertime is last year, is again when we experienced that outbreak of Mpox. We just want to be ready for it. It is, after all, Pride Month is wrapping up, but then it's the summertime, a lot of social activities, things of that nature, a lot of travel too. And so as you can see here, we've been having consistent activity of, a handful of cases popping up over, recent months, but also just generally for the year as well. So it's not something to overlook. Again, this is national data, but still, this is also implying that, there's some things happening in our region, as well as even, maybe very, very rare cases in Connecticut, but still, fortunately nothing in Norwalk, but at the same time, we want to just be ready for it. And so we definitely have prepared ourselves. And that also leads to the very important point about there's, along with general practice of prevention measures and common sense, to reduce one's exposure, vaccination. And so there's the Jynneos vaccine, which cross protects against Mpox. It's a 2-dose series, so it's important and serious for one to get to those 2 doses, not just stick with the 1 dose. But nonetheless, the CDC put together a really great locator to find clinics where one could, if they're at greater risk of exposure, or just feel they might be best apt to receive this vaccine, they can just go find these clinics, follow up with them, and receive those 2 doses. And so rather err on the side of caution, and again, one could put their zip code and then the search radius they would like to find, and then they can find a clinic that would be best apt to provide them with this vaccine. And so that's going to really help prevent partially against the transmission, but also more so against the severity if somebody does get exposed and experience this illness. So that's just really important. And again, what to keep in mind and keep an eye out for is, there's a very generalized symptoms that one presents with, fever, malaise, things of that nature, pain in certain regions, but then also the stereotypical thing, the very notable thing relative to Mpox is a rash that does produce a lesion. And, sometimes that may spread to some degree on certain parts of the body, but then that's something definitely to follow up with a healthcare provider. And follow the prevention measures to not run risk the exposure of anybody else, but also then subsequently, should somebody test positive, doing the contact tracing to see if anybody else, where they acquired it and who they might have exposed during the infectious time window. But again, those at highest risk, generally speaking, are men who have sex with men. Again, from the outbreak last year from the state of Connecticut, that was about 90% of cases that presented. So, very strong correlation there. And so just wanted to kind of just emphasize that point, because we're still in the midst of, we're not even officially in the summertime yet, right? And so it's really important just that we get through this, this year, just avoiding those unnecessary exposures, and also the severity of risk should somebody not have been vaccinated appropriately. So that's that with Mpox. Now switching gears again to mosquitoes. This is just the mosquito surveillance that the Connecticut Agricultural Experiment Station does. Just want to make you aware that mosquitoes have been collected at these sites, although it's a very low volume relative to the 2 sites that are in Norwalk and Cranberry Park, where we're waiting school. So far, all have tested negative for any of the viruses of concern. There has been one in the state of Connecticut that has tested positive for Jamestown Canyon virus. That's in North Haven. But other than that, so far it's still earlier in the season, but I just want to warn again, with this very warm weather and wet weather that we're experiencing with rain here and there, it's going to create more opportunities for obviously more puddles and other sites that mosquitoes can grow, lay eggs and grow in, and so therefore expand their territory and volume. So that's something to be ready for again. And, that ties into the general prevention measures, using appropriate insect repellent that's EPA registered and appropriate, wearing certain clothing that may be better, especially at certain times of the day, to avoid that risk of getting bit by mosquitoes. And just other kind of common sense processes that may be helpful to protect oneself. And then also reducing those sites where that water collects, draining those sites or making sure that they're not there, so that the examples are usually lids or from a garbage can or open garbage can or a tire or something like that. So that doesn't create opportunities for mosquitoes to lay eggs and produce more, and expand their territory. So those are other kind of general common sense, items to kind of keep in mind. And so with that, switching gears now, again, once more, these are 2 CDC HANs, Health Alert Network messages that have come out very recently, just this month, that I just want to make you quickly aware of. And again, this is generally more for clinicians, but I think it's also important to empower the community just to make themselves aware of this. And so number 1 is in regards to measles. So measles is one of the most infectious viruses that we know of. It's a vaccine preventable disease. So again, we have vaccine that is very effective in preventing it in terms of transmission as well as manifestation of severity symptoms. And so it's been tied to the summer travel season. About 88% of those cases that have presented so far this year is related to international travel to countries that are endemic with measles activity, or unfortunately, it's related to travel. Have very severe exposure. So that's even including popular tourist destinations like in London, in the UK. So that's something that I think it's just a cautionary measure. Just be mindful of this as one travels. Again, common sense measures to protect oneself, being vaccinated, and with the appropriate vaccinations relative to the countries one may be visiting. I think that's a really important point, but just something to be aware of, because measles creates a very complicated and complex circumstance, should we have any exposures, because individuals usually go to healthcare institutions and they expose others, and given its high infectivity, there's a lot involved in the contact tracing and the control measures, especially those at higher risk. And so we want to obviously avoid those circumstances and then also protect, oneself and others. So that's just really important point. And then also one other very recent, Han message too from the CDC is about malaria. So this is just another thing for general awareness. Locally acquired malaria cases, in Florida and Texas. So 4 in Florida, 1 in Texas. So basically what that means, there's been successful transmission of malaria by, mosquitoes inside the United States. So it's not somebody coming here from another country and then presenting with the illness. This is the presumption that they might have acquired it here somehow. So again, how this kind of, may have made it here, obviously it's some sort of international travel. But now there's actually locally acquired cases. So this is just something to have on our radar. This is very unique. This is again, tied to climate change, some other kind of, unique circumstances tied to obviously malaria and, the health control measures and things like that. But nonetheless, the thing to keep in mind is that there's the risk of malaria, very low risk right now. But this could be a growing issue and likely maybe relative to Florida and Texas at minimum. So this is a big deal in that sense. We'll probably hear more about this in the news, but this just came out the other day. And just wanted to make you aware of this as well. So mosquitoes is the name of the game, especially with this weather, with any hot and humid places like Texas and Florida, you're definitely going to have greater risk of exposure there. But, with climate change and, things, all the things that kind of consider with that, they could also grow and expand their territory. So the messaging shared before about mosquitoes is very applicable even in these circumstances. So with that, I know we covered a lot, but again, just to summarize, respiratory illness situation, we're doing pretty well. Mpox is still something very much a concern and keep an eye on, especially from a clinician standpoint, but also anybody that may be at higher risk. There is a vaccine available. Definitely seek it out ASAP and do that 2-dose series. Mosquitoes are still very much a concern locally and nationally speaking, especially when it comes to, just the standard West Nile virus, Triple E here locally, but then also malaria now to consider, from a national perspective in certain areas. And then also, measles, just keep in mind that we have, vaccine preventable disease. That's, the vaccines existed for quite some time, very effective. And so just making sure that, those especially that got lost to care during the pandemic, that they really follow up and kind of get that addressed ASAP so that we can reduce those risk of exposures. So with that said, that is the overall summary and update for today. Thank you.
Thank you so much, Brian. Does anybody have any questions?
Just a quick, yes, any update on tick-borne disease in Connecticut?
Yeah, so ticks are still very much an issue as well. So vector-borne disease is the name of the game. As I shared previously, I don't want to keep showing it, but we have to keep in mind that Westport surveillance location of the adult Ixodes, scapularis, deer ticks, 50% of them were infected with Lyme disease. So that's something else we want to really keep in mind, and tick activity is definitely going to be benefiting from the mild winter that we had, the weather that we're experiencing. So that is still very much a concern. I just know I've hit that home quite a few meetings, so I don't want to kind of keep saying that, but at the same time, yeah, it's still very much a growing issue, and especially with non-native ticks as well as non-native diseases, if you want to call it that, that have entered the picture, like anaplasmosis and things of that nature. So just be mindful of that. But again, the big point to take home too is, again, those prevention measures, covering up, especially if you're hiking an area with high brush or vegetation. My big thing is just keeping an eye out for pets, really inspecting oneself, but then also one's pets to see if they're picked up any ticks, and especially behind the ears, the legs, places that you typically wouldn't be checking. But that's going to be really important. And then insect repellents would also apply relative to ticks as well. because we want to reduce their territory, but they've definitely benefited over the years from, even climate change, if we want to tie it back to that in terms of, just these mild winters that we've experienced that don't really adequately reduce their population. But again, 50%, of those adult deer ticks, were infected with Lyme disease. So that's very concerning. So again, that's pretty high risk. If you do get a tick and you're bitten, the odds are, and that's why you would get that prophylactic treatment, that you might have been exposed to something that it may be carrying.
Thanks, Brian, and thanks for the question, Dr. Weinberger. All right, so next on the agenda is some grant updates. I wanted to let everyone know that Community Health Division has been working hard on grant applications. So the U.S. Preventive Health and Human Services Block Grant used to be just designated and guaranteed to go to local health departments, but the state has changed the way of distributing the funds, and I've changed it to an RFP process. And so Teresa and her staff have been working hard on that, and they submitted the application last week. In the past, we've used that block grant. It's been about $30,000. We've used it to support some of the Health Education Associates time, to support our Healthy Restaurant program, to support the Growing Gardens program, some of the operational supplies. We've also utilized that funding to work with the Transportation, Mobility, and Parking Department to plant trees to support walkability within neighborhoods and the built environment. So they just submitted a new application. It's for a 5-year contract. So we're hopeful and hoping that we get the awarded funds. But there's about, I think, 4 main areas that they submitted the application for. It's to continue with the Norwalker program and the pedestrian safety projects, to continue the Know Your Numbers health screenings and connect to even more community resources, and to look at continuing to support a bilingual, bicultural community health worker to assist with that work, to continue with the Growing Gardens, Growing Health Community Garden Initiative, and then all the food access initiative efforts as well. So hoping to hear good news, but wanted to let you all know that they've been working hard on that application. And they also submitted an application for a produce prescription program. And so that's with through the National Institute of Food and Agriculture and the USDA. So that's a national grant. And so we know that there's many departments and agencies across the country that applied for that. But they did, Kelly and Teresa and others worked really hard on that application for a produce prescription program for Newark residents who are eligible for SNAP or enrolled in Medicaid and who have a diet-related chronic disease. So wanted to let you all know about that too. So we'll keep you posted. We'll let you know if we're awarded the application or not. So, and then last, the state had reached out to us about a year ago about a suicide prevention grant. And so we had just got the contract within the past month or so. So we're going to be able to move forward officially with that work. So that was great news too. Those are my grant updates. Any questions?
The suicide grant, is that going to have a hotline? Is that meant to be outreach to schools? I mean, what is the?
There's a lot of different components to it, but a lot of it is like working with the different community providers and connections. It's a lot of like outreach. I mentioned like support some advertising and promotion messages. And linking with the regional suicide advisory council as well as the state one too. And so there is some involvement with the public schools and other partners as well. All right, the last item on the agenda is public participation. I don't see anybody who's on the meeting though. Is that correct, Daniela?
That's correct.
All right, so no public participation today. So anything else before we wrap up?
Yeah, I just wondered, do we have any update on the food safety restaurant ratings program? I know that everything's being overhauled.
Yeah, so I don't have any specific updates related to any, like, so some of the other departments are interested as well, like in about like updating the program. But there hasn't been a lot of movement lately on it. It's been mostly focused on the transition to the FDA food code, getting really comfortable with the program, getting the restaurants and the food establishments comfortable with it. So we're still in that phase now where we're transitioning, and then the next step will be to look at the inspection program. But I can also follow up to see if there's any updates, with other departments. But I think mostly it's been focused on just training on the FDA food code itself.
Okay, thank you.
Sure. All right. Well, have a great day, everyone. It's nice seeing you all.
Okay, bye.
Take care.
Thank you. Thank you, Jan.